We have a fantastic emergency department. We are very busy. We see a lot of patients, about 70,000 a year, and we have such a wide variety of pathology and different types of patients that we see.
Henry Ford Macomb is a community hospital leading to a variety of patients and acuity. We see pediatric patients to elderly patients, some of them very ill. You can have one day intubating a 5-week-old, another intubating a 90-year-old.
We are the top 100 heart hospital. We are a stroke destination, and we are leading the Henry Ford system in sepsis.
What keeps our emergency department running so well with the volume that we have is the collaborative work we have with the physicians, the nurses, the techs, and all the other supportive staff we have in the ER.
Everyone's always got each other's back. We work great together. You're never alone on a case. You always have people to bounce ideas off of. You've got people to help you out.
The biggest thing that struck me as a medical student here myself many years ago was that the residents actually were the ones that were doing a lot of the teaching, and I found that very impressive.
We take ownership of our own cases, but we do have attending supervision at all times. So they're able to help us with procedures, seeing the cases right away, and we get immediate feedback, which is also very helpful.
The attendings and residents have great camaraderie in our program. They create a perfect learning environment. They are our sources of information, of support, of education.
We have an excellent faculty on staff here. I hear over and over again that the faculty is the reason why a lot of our residents choose to come to this site. We have 8 dedicated core faculty members who are involved in regular education and evaluation. And we have 2 junior faculty members who are really working to enhance our simulation and our ultrasound programs. In addition, we have 7 other clinical faculty members who work with our residents on a daily basis in the busy emergency department.
One nice thing is that there's no opposition. So we see the cases right away. We take on the procedures. We have no trouble meeting metrics as far as procedures go. Maybe a simple laceration and maybe a chest tube all in one shift, but we hit everything right away, and it's really never been a problem to feel comfortable and supported during the procedures.
Our facility here at Henry Ford Macomb Hospital, we see a vast array of pathology as well as high-intensity care. As soon as you walk in the door as an intern resident, you're able to see an incredible amount of pathology. It's not atypical to be intubating on your first day. It's not atypical for you to be performing a high-intensity procedure like a central line.
The foundation of our training program is emergency medicine, but we also are focused on providing dedicated critical care and pediatric training to our residents.
We do have several outpatient rotations just to further strengthen our experiences, like pediatrics specifically.
And having access to a high-fidelity simulation lab is very invaluable to my residency training. Having the complicated cases that you come across, having that practice just gets you ready for whatever comes through the door. And the ultrasound machine that we have here is state-of-the-art. It's got everything that you would possibly need. It's got a large screen. It's even got built-in tutorials to kind of help you out. It's a great machine to learn on.
We have a lot of teaching in our program. It can vary from lectures to clinical teaching. As a resident and a senior resident, you have the capability of teaching medical students and the interns in any class beneath you.
Being part of the Michigan State statewide campus system, we are exposed to different types of labs that are available. There are ultrasound labs, ophthalmology labs, trauma labs, mock code labs that give us the advantage of practicing these high-intensity cases that we can bring onto our emergency department.
We have weekly protected time every Wednesday for didactics. We also frequently do board preparation sessions. And so far, our first pass board rate is 100%.
A lot of us have the opportunity to present at both statewide and regional conferences. It's nice to see that your cases are presented on this stage. It's something we all take pride in.
We run a 3-year ACGME accredited emergency medicine training program. We take 8 residents every academic year. Henry Ford has been training physicians for over 100 years. At this site, we recruit residents from across the country, and when they leave our training programs, they're able to get a position at any facility of their choosing, from the East Coast to the West Coast, really nationwide.
Life as an emergency medicine resident is an incredibly rewarding yet demanding profession. It's very easy to finish a shift and have to find needs to decompress that.
Macomb County is a rapidly growing suburb of Detroit.
Around Metro Detroit, There's so much to do. You've got all the sports teams around, go and watch a hockey game and a baseball game, but you've also got a bunch of restaurants that you can go out to eat. There's always a new one popping up everywhere.
I really work to promote an atmosphere of curiosity, collaboration, and most importantly, compassion.
I would most definitely choose this program again. It was my #1 residency spot, and I wouldn't change that.